Honestly, the most important thing you can do for suhoor, if you're an avid coffee drinker, is have a cup of coffee during suhoor. That way you can avoid a caffeine headache in the morning. So this is a very, very crucial part of my Ramadan fasting. Okay, so I prepped this last night, so it's ready to be baked this morning for suhoor. It's a really hearty and healthy egg and hash brown bake with a bunch of veggies. So I have hash browns at the bottom here, and then a bunch of veggies, and then eggs on top. And this is really important to be able to have a really good suhoor in the morning so that you can have energy that gets released during your day. After we take our last few sips of water and food, we set up and we do our morning prayer. I'm going to attempt to fall back asleep. It doesn't always work. Sometimes I'm able to and sometimes I'm not. Since I'm on anesthesia, I don't have to get to the hospital till 6:30, so I have about an hour that I can go to sleep, which is actually really, really helpful. When I go back to surgery in a week, I will be basically getting up for suhoor, getting ready, and then going to the hospital because I have to be there at 5:30, so I will not be able to go to sleep. So I'm going to try to take advantage. I'm going to try to close my eyes and see if I can fall asleep. I'll let you know how it goes. I was able to sleep about an hour after suhoor, which is really, really awesome. Usually I can't take that nap right after suhoor because I either have to get to the hospital earlier or I have to be up so that I can take Ozzy on a walk. But luckily my dad is here for Ramadan. A lot of you guys, if you follow me on Instagram, know that he has made my life so much easier because he's making food for us and he's taking Ozzy out on a walk. So it saves me a ton of time in the morning and I'm able to get like an hour and a half of sleep right after suhoor, and then I'm waking up like right at 6 a.m. and then driving to the hospital about 15 minutes to get there. Usually I'm only a 5-minute walk from my primary hospital, don't have to do any commuting, but I'm on pediatric anesthesia right now and that's at a different hospital, which is about a 15-minute drive. So I am going to get on the road now and get to the hospital and let you know what my day looks like on pediatric anesthesia and how it is to fast. So I'm usually one of the first people to get into the operating room because I want to be prepared for my patients when they come in here. The nurses also have to prep the room, go talk to the patients. The anesthesiologists are usually getting consent, and so I come into the room, I prime my IV bag, you know that this takes time and is a little bit of a headache. And then I get my drugs labeled and ready for the patient based on their weight, because everything in pediatrics is based on weight. And then I make sure that I have everything else that I need for anesthesia prepped, like my blades, my intubation tubes, and everything else. And so it takes quite a bit of time. So depending on how many cases I have in the day, either 4, 5, or 6, I'll prep whatever I can before the patients get here. There are a lot of things that you can only do when the patients are here, but there are some things that you can prepare for because I don't want to play catch up in between cases. I just want to be really efficient and go, 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 go. Pediatric OR is very similar to an adult OR. You have your anesthesia machine here with all of your circuits, and the only difference is we have pretty cool decorations. I wish adult ORs had this. When kids come in here, we try to distract them and show them all the decorations on the wall, tell them they are in the submarine room, and they get really excited, and it gives us time to be able to induce them. I try to keep it simple and give the bare minimum amount of drugs to make the patient comfortable and make sure that they're nice and asleep during the case. The first drug that I draw up is rocuronium. This is a paralytic, so you use this to give the patient in order to intubate them and paralyze their airway so that you can do it easily. The other drug that I draw up is Precedex. This is a really great drug to use in the pediatric population. It really helps with sedation and decreasing your use of the gas anesthetic, as well as a better wake up. And so I try to give it a little bit in the beginning of the case, during the middle of the case, and at the end right before extubation. We also do IV Tylenol, which works really well for pain control. We also give Toradol, which is basically similar to a IV form of ibuprofen. And then towards the end of the case, I'll give Zofran for nausea, and we also give Decadron, which is a steroid that also helps with post-op nausea and with swelling and inflammation. We give a very, very low dose of this, so it's not like a normal steroid dose. This is just very, very low and is proven to have a really good patient outcome once they are in the recovery room. So those are really the only drugs I use. And then during the case, we use a gas anesthetic to keep them asleep. In children, we do a gas induction, which means that they come into the room, they're fully awake, and then we give them some oxygen and some nitrous to just get them nice and relaxed. And this is a really great tool because nitrous doesn't smell like anything, so it's a great gas to start with. And then once they're nice and relaxed, we'll add in some sevoflurane, which is your primary anesthetic. This does have a very chemically smell, so a lot of kids don't love it. That's why we start with the nitrous, and then we kind of crank it up to get them nice and relaxed. And then once they fall asleep, that's when we place the IV and intubate, because in children it's really hard to start an IV in pre-op, which is generally what we do with adults. And so we do the gas induction, not the IV induction. And adults a lot of times will place the IV in pre-op, and then we'll give them sometimes Versed in the pre-op to get them nice and relaxed. And then when they come into the OR, we do an IV induction. So we're inducing them with propofol, giving them sucks in order to get them nice and paralyzed for intubation. And then we put them on a gas once they're intubated. In kids, we bypass the IV in pre-op and place it once they're nice and asleep. Because as you can imagine, placing an IV on a child can be really, really challenging, and you don't want them to go through that. And so I have some lidocaine jelly, which just helps with putting the breathing tube through their nasopharynx. We do nasal intubations for a lot of these dental cases. I also have some eye protective stickers here to make sure that their eyes are nice and protected. And then I have my McGill blade. This is what we use to intubate. And then I have my McGills, which will help me pull the tube from their nose into their vocal cords so that we can get it into their trachea and be able to ventilate them. And then of course I have my tape so I can secure the tube, and then this other tape in order for me to do a head wrap. So that's pretty much all that I need to do in between cases, as well as run a couple of system tests to make sure that my ventilator is still working properly. In pediatrics, everything is based on weight, so I wait until the patient gets to pre-op and then make sure I confirm their weight and then pull drugs based on their weight. So I'm all prepared, I set up everything, and I'm ready for my patient. In pediatrics, you really want to move very, very quickly because you don't want patients to wait around in pre-op and recovery. It's kind of a scary place and they don't really understand what's going on, and so you want to be really efficient and really quick, which is always my goal. And that's really challenging because we do anywhere between 4 to 6 cases in a day between basically 7:30 a.m. and 4 p.m. And if you keep in mind the operating time, the pre-op time, recovery time, it's really, really fast paced, and we turn over these rooms in between each patient. So you're really like go, go, go all day, which is a huge advantage during fasting, because I literally like get here at 6:30 a.m. and next thing I know it's 4:30, and I'm like, wow, where did the day go? And so I love staying busy during Ramadan and being able to just like get to work and do everything. And the other advantage about fasting while on pediatric anesthesia is during lunch, I don't have to worry about food. I just go and take the time to like reset and relax and breathe in between my patients, instead of focusing on like running to the cafeteria and getting food, and all of that. So it's really a lot of me resetting, which has been a huge advantage, for me to be able to take advantage of my lunch as like some mindful meditation and just taking a breather and a break instead of just like quickly chowing down my food. So that was a kind of unforeseen advantage that I've really enjoyed the last couple of weeks. And so that's it. I'm waiting for my patient to get in. They'll probably roll them in pretty soon, and then we'll just go from case to case, First 3 days of Ramadan are a little bit difficult to get used to because I am so accustomed to making my travel mug of coffee and being able to sip on it during the morning time. And so what I do to avoid caffeine headaches is I try to wean my coffee intake a couple of weeks before Ramadan. And then when Ramadan starts, I make sure I have a cup of coffee during suhoor, which is the pre-dawn meal that I showed you guys earlier. But once the first couple of days pass, I'm honestly physically on cruise control. I don't feel hungry. I don't feel thirsty. And, you know, I definitely have a lot of energy in the morning because I'm very smart about my suhoor choices. And I will show you guys some of my favorite recipes in another video, or follow me on Instagram at 15 Blades because I do talk about a lot of my suhoor recipes. But you have to be very smart about your food choices because if you're choosing things that are going to give you a sugar crash, that's no good. Always eat things high in fiber, high in protein, things that are going to give me long-lasting energy. And so I'll have cottage cheese, some berries, some dates, I'll have eggs sometimes, avocado toast, lots of things that are good for me that are going to give me energy throughout the day. I do get pretty tired, probably like 1 to 2 hours before breaking fast, but I think that's totally normal. And, you know, I try to just during that time either take a little bit of a nap or try to do something a little bit mindless. And if I do have a little bit more energy, I will do something like pray or read Quran to just kind of get into the spiritual aspects of Ramadan as well. And so really that is the only difference in my day while I'm working during Ramadan. It's a pretty nice day today, so I'm gonna sit outside, enjoy some sunshine and some fresh air since I'm not eating or drinking. Honestly, I'm not even feeling hungry at all. My suhoor really keeps me quite full for a very long time, and I don't start feeling hungry till probably around like 5 or 6. But what I would love to have right now, if I could, is a cup of coffee, but I'm gonna try not to think about it. All right, so my lunch is done. I am on my 4th case out of 5, and so hoping to get out a little bit early. Usually with 5 cases, I'll get out around 4 p.m., but I'm working with a really fast provider today, so I will plan to get out at 3 if possible. I am done for the day. It is about 4 p.m. I'm going to drive home and see what my family's up to, maybe take the dogs out for a walk. We did a lot of cases today. We did about 6 cases, so it was a lot. So I am feeling a little bit exhausted, but honestly, still not hungry, still not really thirsty. But I'll let you know if that changes in a couple hours. I have about 3 more hours to go, and then I can have iftar. So it's about 6 p.m. and I am feeling pretty exhausted. So I am going to take a 20 to 40 minute nap. We'll see how long it'll be. I'm gonna set my alarm for 20, but sometimes I do snooze twice. So it ends up being a 40-minute nap. I just feel like I need a little bit of energy, and so I'll wake up right before iftar. And luckily, since my dad is here, he is making most of the food, so I'll just wake up in time to be able to heat things with him and prep the table and stuff like that. It is time to go and start prepping food for iftar. I'm really excited. My dad making food for iftar. This is stuffed zucchini and it looks so delicious. We're sitting down and having iftar. One of my favorite things to do after iftar is make a hot cup of tea. I just crave caffeine when I'm fasting, and so this is one of my favorite parts of the day. After breaking fast, I'll make tea, sit down, kind of decompress, have a little bit of dessert, and then we'll pray Maghrib prayer, and then shortly after we'll pray Isha, which is the final nightly prayer of the day. And then shortly after that, we go to bed. And so it's a pretty quick, short day. And we don't honestly end up eating very much after iftar. We just kind of transition from iftar to bedtime. So this is the ultimate post-iftar cravings. We're going to get our brownies ready. We picked up some ice cream because, you know, after iftar, you got to have some yummy dessert. Because tomorrow when you're fasting, you're going to have a lot of regrets. That's how it works. Brownies and ice cream. We're going to relax a little bit and then go off to bed.